Hello, and welcome to our presentation, Breast Cancer and You, The Importance of Exercise. My name is Tim Miserandino. I'm a student physical therapist at Messiah College, and joining me in this presentation today are my three other classmates, Rachel Sullivan, Amanda Crecilius, and Sean Smith. I'm going to open our presentation today by discussing a bit of background information on breast cancer. Breast cancer is the most common non-skin cancer among women, and there are currently over 3.5 million breast cancer survivors in the U.S., representing more than 40% of female cancer survivors. The risks for developing long-term side effects after breast cancer treatment are multifactorial and include age at the time of diagnosis, comorbidities in type, dose, and duration of treatment. In the following slide, we will dive a bit deeper into common side effects associated with breast cancer treatments and their interventions. Here we can see a chart that outlines the common side effects associated with breast cancer treatments and interventions. Please know that this is not an exclusive list, nor is it representative of personal experiences. The hope is that you can see just how impactful and aggressive treatment interventions can be. Some of you here today may have been exposed to one or more of these interventions, and we believe this chart really puts things into perspective for those that may have similar experiences or those that have yet to do so. One of our goals here today is to educate and empower you to know you're not alone, and that there are options out there to help combat some of these side effects, exercise being one of the most important preventative factors. The next couple of slides are meant to help expose you to some side effects you may be experiencing or have experienced in the past, and some are side effects you may have yet to experience. First up is lymphedema. It occurs in approximately 20% of all women following surgery or radiation. The picture on the bottom left is showing what we call secondary lymphedema. That just means it's lymphedema that occurs due to surgical intervention, like removing axillary lymph nodes or radiation. You can see there is a chronic swelling of the patient's left arm, but lymphedema can occur in the breast, chest wall, and in the back as well. The picture on the bottom right is showing what's known as axillary cording. It occurs in about 10% of patients after axillary surgery and is known to increase the risk of developing lymphedema. There is a development of a tight, uncomfortable, cord-like structure that can be felt, and sometimes seen, in the armpit and often extending down the arm. Cording is important to understand and identify because it can not only lead to a restriction of movement, but also to the development of lymphedema. It is important to understand lymphedema and its presentation, and to take the appropriate measures to see that it is managed properly. There are specialists within the realm of physical therapy that specifically help individuals in their management of lymphedema, and we encourage those that find they may be dealing with this to seek their professional help. We are more than willing to provide that guidance and resources if you need. Feel free to talk to us personally or through the contact information we have provided. Moving on to cardiotoxicity, I just wanted to highlight some important ramifications of treatments. As you can see, certain types of radiation and chemotherapy are associated with increased risk of developing cardiovascular complications, and some of these effects may not be present until up to 20 years after cancer treatment. Complications can include hypertension, arrhythmias, coronary artery disease, heart failure, valvular disease, thromboembolic disorders, peripheral vascular disease, stroke, pulmonary hypertension, and pericardial complications. The good news? Exercise can help decrease and prevent these symptoms from occurring. I'm sure many of you can relate to this next slide, and it's the most common symptom experienced by breast cancer survivors, with prevalence rates ranging from 15 to 30% to 70 to 99%. I find this is something I experience on the daily, so I can only imagine the degree with which some of you feel this post-treatment. Cancer-related fatigue may remain for years after treatment. Once again, we're here to show and tell you how exercise and remaining active is going to be one of your biggest allies in dealing with this cancer-related fatigue. I am just going to touch on some quick statistics regarding the neurologic effects breast cancer interventions can have. As you can see, about 58% of survivors develop chemotherapy-induced peripheral neuropathy, which is that numbness or tingling in the arms or legs you may have experienced. Additionally, impairment of cognitive function, such as problems with concentration, executive function, and memory, are reported in up to 35% of breast cancer survivors after treatment completion. Obviously, cognitive impairment is a multifactorial phenomenon. Age, comorbidities, and genetic factors play significant roles related to risk for cognitive dysfunction. Here we'll talk about bone and musculoskeletal issues. This is a big one. Almost 80% of breast cancer survivors experience some degree of bone loss. Hormone therapy is one of the most common causes of decreased bone mineral density and quality. The good news is that exercise, specifically weight-bearing exercise, can directly counteract the negative effects of these medications, or at least reduce the amount of bone loss greatly. Breast cancer survivors may report musculoskeletal issues after surgery, such as decreased shoulder range of motion, rotator cuff disease, adhesive capsulitis, or axillary web syndrome, which is that cording we talked about in our lymphedema slide. Premature menopause and infertility are not spared from breast cancer treatments. As you'd imagine, hormone therapy can send the body's systems into whack. Approximately 10% of breast cancer survivors older than 45 experience chemotherapy-induced menopause, and tamoxifen use is associated with decreased fertility among premenopausal cancer survivors. Additionally, menopause symptoms such as vasomotor hot flashes are observed in among 50 to 70% of tamoxifen users. Not surprisingly, sexual dysfunction becomes affected, especially when hormones are constantly being adjusted through medications and/or the side effects of treatments. Last, but certainly not least, are body image and mental health concerns. The loss of a breast, lymphedema, hair loss, skin changes from radiation therapy, weight gain, or early menopause affect 31 to 67% of breast cancer survivors. Depression and anxiety symptoms affect up to a quarter of breast cancer survivors. Breast cancer survivors have a 60% increased risk of developing depression, anxiety, and stress-related disorders within 10 years after cancer diagnosis. The most important thing to remember is that you are not alone, and that there are plenty of resources available to get you the help you need. As aspiring physical therapists, we are here to advocate for you. Your well-being and needs come first, and we want to empower you to take the next steps in controlling your life and giving you the necessary tools you need to prosper now and going forward.
Now, I will build upon the side effects of breast cancer that Tim mentioned by explaining the importance of exercise after treatment. This picture was in the latest volume of the American Physical Therapy Association magazine as an advertisement for Ford Orthotics, but it really can relate to any aspect of physical activity. It reads, "A body in motion tends to stay in motion unless acted on by an outside force. Your diagnosis of breast cancer was an outside force that stopped you in your tracks, but I'm going to convince you how important and beneficial it is to keep your body in motion." One of my professors in graduate school presented this picture on a PowerPoint slide in a lecture on pharmacology. It reads, "What if there was a drug that could improve your mood, increase your sex drive, help you lose weight, help you sleep better, improve your self-confidence, increase your patience, give you energy, regulate your digestion, increase your earning potential, make you more attractive to others, help you appear younger, improve your skin tone, eliminate most aches and pains, lengthen your life, and allow you to eat more? There is. It's called exercise." Almost all of these benefits, if not more, contradict what Tim just mentioned about the side effects of breast cancer. Here's a quick slide that compares the side effects of breast cancer treatment in red to the benefits of exercise in green. I have this in your handout so you can reference it as we go, because I'm going to explain each side effect in more detail and support it with current research. Feel free to write any information down in your handout. In regard to lymphedema and exercise, a randomized clinical trial conducted by Sinir et al. Compared the effect of Pilates to normal lymphedema exercises. The study included 60 female patients who developed lymphedema after breast cancer treatment. The study concluded that Pilates is a safe treatment method and can be included in exercise treatment programs. Also, a review conducted by Wirtz et al. Looked at the effectiveness of physical activity interventions and programs during rehabilitation and after breast cancer. When discussing secondary lymphedema, the interventional studies show that physical activity is not contraindicated with breast cancer lymphedema and moderate training is encouraged. In regard to cardiotoxicity and exercise, a study by Sturgeon et al. In 2014 looked at finding the effects of exercise on cardiovascular outcomes before, during, and after treatment of breast cancer. They concluded that exercise improves cardiovascular function, but there needs to be more information on cardiotoxicity in patients with breast cancer. Therefore, I was able to find a review conducted by Wirtz et al. In 2018 that reviewed the prospective cohort study with patients with non-metastatic breast cancer. It was concluded that exercise reduces the incidence of cardiovascular events. Education about the importance of exercise and lifelong adaptations for survivors of breast cancer also experienced a decrease in cardiotoxicity. In regard to fatigue and exercise, a review conducted by Wirtz et al. Combined evidence from 3 articles in support of exercise during and after breast cancer treatment and reducing fatigue. The first article was a review by Mutison et al. That examined 113 randomized clinical studies with 11,525 patients and concluded that exercise is effective in reducing fatigue and that exercise is significantly more effective than pharmacological treatments. The second article by Chavez et al. Performed a systematic review of 14 randomized controlled trials and concluded that physical activity can be increased in patients with breast cancer by prescribing exercise based upon mild, moderate, or severe fatigue. The third article by Juvet et al. Performed a systematic review on 25 randomized controlled trials and gathered that there was slight improvement in patients with breast cancer fatigue that performed physical activity compared to adjuvant treatment. In regard to neurologic complications in exercise, a review conducted by Wirtz et al. Combined evidence from 3 articles in support of exercise after breast cancer treatment and reducing neurologic complications. The first article was a systematic review by Streckman et al. Of 18 studies and concluded that balance exercises are more effective than endurance and strength exercises combined at decreasing chemotherapy-induced peripheral neuropathy. The second article by Hardman et al. Looked at the effectiveness of exercise in reducing cancer-related cognitive impairment and found that early implementation of exercise, less than 2 years of breast cancer diagnosis, leads to improved cognitive processing speed. The third article by Irwin et al. Is predicting that physical activity will be able to decrease pain, intensity, and duration from the clinical trial he conducted, but more studies are needed to make a solid conclusion. In regard to bone and muscle health, a review conducted by Wirtz et al. Found evidence to support bone and muscle issues associated with breast cancer treatment. Strength training can improve pain and loss of sensitivity. Aquatic therapy and home-based training can improve functional range of motion loss and improve quality of life. A study by Daly-Conright et al. Inferred that an increase in muscle strength can occur anywhere from as little as 2 months to 1 year, so consistent lifelong exercise is very important to survivors of breast cancer. Even though premature menopause, infertility, and sexual dysfunction may occur after breast cancer treatment, it has been proven in a review by Wirtz et al. That exercise after breast cancer treatment can improve quality of life. A survey with 537 breast cancer survivors demonstrated that physical performance and activity as having a positive correlation with quality of life. Duncan et al. Reviewed 21 randomized controlled trials on physical exercise and interventions such as yoga, resistance exercises, and aerobic exercises that Amanda and Sean will explain shortly, and they concluded that those exercise interventions are effective at improving overall quality of life in cancer survivors. In regard to body image concerns and mental health issues, a study by Rosenberg et al. States that there is a positive correlation between relaxing mind-body exercises, such as yoga, and decreasing anxiety and depression. Consistent participation in physical activity also decreases the possibility of breast cancer treatment weight gain and decreases the feeling of body image concerns in young patients with breast cancer.
For exercising considerations, it is important to look at range of motion, lymphedema management, and when to stop exercising. For range of motion, after surgery or radiation, it is important to restore motion to the arm and also the shoulder. For lymphedema management, pre- and post-operative measurements are encouraged to be able to identify lymphedema. Long-term compression garments can be used to treat lymphedema. Sometimes manual lymph drainage has also been proven successful for treatment of lymphedema. When to stop exercising. Immediately stop if you become weaker, if you start falling, feel dizzy, if there's new numbness, blurred vision. Also, if pain gets worse, if there's new pain arising such as heaviness, aches, tightness, or sensation in the arm. Now looking at the week after surgery, we never want to start exercises with you before talking to your doctor. The first exercise we could do was tell you to gently raise up your arm to a comfortable point and open and close your hand 15 to 25 times. You can also bend and straighten your elbow slowly about 10 to 15 times for 2 sets. You can reach across and touch the opposite shoulder 10 times for 3 repetitions. Breathing is important for you, and us as the therapist will educate the patient on how to perform these breathing exercises. You will want to lay supine and expand chest and abdomen away from spine as you breathe in and slowly release breath as air flows out. You will want to perform this 6 times a day for 4 to 5 repetitions. Next, we are going to explain some of the exercise interventions. One exercise that will be beneficial to you is called the wand exercise. The purpose of this exercise is to increase shoulder movement forward and overhead. The equipment that you will use is a broom handle, stick, or yardstick. To do this exercise, you will want to lay on your back with knees slightly bent and your feet flat on the floor. You will hold the stick in both hands with palms facing up towards the ceiling and elbows extended. You will slowly move the stick overhead to a comfortable position. You will want to hold this for 5 seconds and perform this exercise 5 to 7 times. For the elbow winging exercise, the purpose is to increase movement in the front of the chest and the shoulder. You will want to lay on your back on either a bed or floor with knees slightly bent and feet flat. You will clasp your hands behind your head with elbows pointing towards the ceiling. Then you will slowly move elbows apart towards the ground until a comfortable stretch is felt. You will want to perform this exercise 5 to 7 repetitions. A stretch that is recommended for you is the shoulder blade stretch. The purpose is to increase shoulder blade movement. You will need a chair with a back and also a table. To do this exercise, you will sit in the chair with your back flat against the back of the chair, performing one arm at a time if both arms are affected. If not, only one arm. Place one arm on the table with elbow bent and palm down. Arm performing the stretch is placed on table, palm down, and elbow straight. You will slowly slide arm forward towards other side of the table without moving your trunk, and you should feel a stretch in your shoulder blades. Then you will relax arm and move back to the starting position. You will want to do this stretch 5 to 7 times with each arm that is affected. The side bend exercise is to increase movement of the trunk and the body. For this exercise, you will need a chair, and then you will be instructed to sit in the chair and clasp hands together in front of you. You will lift arms slowly overhead with arms straight. With arms overhead, bend your trunk to one side as far as tolerable while keeping arms overhead. Return to starting position and perform the same task on the opposite side. You will want to do this exercise 5 to 7 repetitions to each side. Another important stretch to do is the chest wall stretch. The purpose is to stretch your chest. You will need a corner with walls on both sides. You will then stand facing the corner with toes about 8 to 10 inches from the corner. You will bend elbows and place one forearm on each side of the corner about shoulder height. Keep arms and feet in place and move chest towards the corner until a stretch is felt in the chest and in the shoulders. Keep ears over shoulder to avoid causing neck soreness. You will then return to the starting position. You will want to hold the stretch for 5 to 10 seconds, and then you will do this 5 to 7 repetitions.
Now I will build off the exercises that Amanda has already mentioned and list a few other types of exercises. Aquatic therapy is great for breast cancer patients because it improves emotional well-being, all while decreasing the negative symptoms associated with breast cancer treatment. Now, not everyone has a pool, so this is something that would most likely need to be done in the clinic. The purpose of this particular exercise is to get the shoulder moving and keep it from getting stiff. A neck flotation device would also be helpful to perform this aquatic therapy exercise. To start, the patient will float on their back with their eyes facing up at the ceiling. They will keep their arms straight and slowly lift it into the air as if they're trying to touch the ceiling. They will then reach their arms straight back into the water over their head as if they are performing a backstroke. It is important for them to make sure that this motion is slow and controlled, and they will repeat 5 to 7 repetitions on each side. Another great type of exercise for breast cancer patients is Pilates, and specifically the mermaid exercise. The purpose of this exercise is to re-educate the patient's posture. To start, the patient will sit on their knees with their weight shifted over their right hip. Next, they will place their left hand on the floor next to their left leg, and with their right hand, they will pretend to draw a rainbow towards the left side of their body and finish in a C position. They will hold this for 5 seconds, and they will perform 5 to 7 repetitions to each side. Yoga is a great way for breast cancer patients to improve social and family well-being, and the Warrior Two pose is a really great yoga pose in particular. The purpose of this yoga pose is to increase range of motion and improve lymphatic health, or your body's ability to fight infections. A chair is really great to use for this pose, and a yoga mat is optional. The patient should start seated at the edge of the chair with their head facing to one side. They should move into a lunge position with their right foot towards the side the head was looking and the left foot on the back edge of the mat. They should then flatten their back foot and lift hips off the chair. They should open their hips and place their right arm straight out in front of them and their left arm straight behind them with their palms facing down. They should hold for 5 seconds and perform 5 to 7 repetitions to each side. Now let's put all these exercises together into one comprehensive exercise program. So for our exercise program, we base it off the U.S. Department of Health and Human Services recommendation of 150 minutes of moderate intensity aerobic exercise per week. So for our exercise program, we will have our patient perform exercise 3 times a week for 6 weeks. Each session will be around 50 minutes, so 50 minutes times 3 will get us to that recommendation of 150 minutes per week. The sessions will be split up into about 15 minutes of stretching, 15 minutes of light aerobic training, such as walking, 10 minutes of Pilates, and 10 minutes of yoga. It is important to note that the patient should continue with exercise after the conclusion of the 6 weeks to prevent cancer recurrence from happening and just living an overall healthier lifestyle. Exercise is also important to reduce cancer recurrence in these breast cancer patients. In an article titled Exercise After Breast Cancer Treatment, Current Perspectives by Diely Conright et al., postmenopausal women found that moderate intensity exercise participation after diagnosis was associated with 34% fewer deaths from breast cancer, 41% fewer deaths from all causes, and 24% reduction in recurrence. This article also mentioned that at least 3 hours per week of moderate to vigorous intensity aerobic exercise may be beneficial in reducing mortality or the deaths from the disease and morbidity or the rate of the disease in these breast cancer survivors. So in conclusion, it is important for you not to be afraid of your diagnosis of breast cancer and be sure to not let it prevent you from being physically active. You should stay motivated by attending talks like this and be sure to engage in physical activity on a regular basis in order to reduce the risk of side effects from your breast cancer treatment. As for the exercise itself, you should focus on exercises that increase the range of motion and strength, and the prevention and management of lymphedema will also be key to increase quality of life and allow you to perform activities of daily living as needed. It is also important for you to keep exercising for life in order to make sure that your cancer does not return. Here is our first page of references. And here are the remaining references. We will now answer any questions you may have.